Helping, and as you can hear, the session will be recorded, and we'll share that with folks who are not able to join. Today's discussion really is about helping rural providers make the most of these opportunities that are being made available through the Rural Health Transformation Program. There's been significant focus on the funding. The numbers are really astounding. But I think the bigger opportunity is what providers are actually going to be able to implement and support with this investment. Improving access to care, strengthening care coordination, supporting quality and patient safety, and building infrastructure to sustain this improvement over time. Our goal today is to connect those priorities with support that can help move this work forward. Next slide, please, Sarah. We are fortunate to have a great group of close partners with us today. I'm excited to have Anne-Marie Day. Anne-Marie is the Chief Operating Officer at the New England Rural Health Association. She brings nearly 20 years of healthcare experience with expertise in rural health, quality improvement, population health, advocacy, grant management, and more importantly, building partnerships, and I can attest to that strengthen rural communities. We're also joined by Travis Boucher. Travis is Vice President of Rural Health Transformation at the Foundation for Healthy Communities. He brings more than 15 years of leadership experience in healthcare finance, operations, and strategy, and now leads the implementation of the Foundation's rural health transformation work across New Hampshire. Chris Herron is Vice President of Quality Improvement at the Foundations for Healthy Communities, with more than 30 years of healthcare leadership experience, including as a Chief Nursing Officer. She leads statewide work that is focused on quality improvement, patient safety, hospital performance, and regulatory readiness. And we're also joined by Karen D'Antonio. Karen is the Quality Improvement Lead for Connecticut, Massachusetts, and Rhode Island with the Northeast CMS Quality Innovation Network Quality Improvement Organization, or QIN-QIO. Karen is a registered nurse and experienced quality improvement leader. She works directly with providers to strengthen care coordination, chronic disease management, patient safety, and sustainable improvement. Together, our speakers bring perspectives from rural health, state transformation, quality improvement, and direct provider support. And we couldn't be happier to have them with us today. Next slide, please, Sarah. We're going to keep the formal presentations brief so that the majority of our time can be spent in discussion. Anne-Marie will set the broader rural health transformation context. Travis and Chris will give us a closer look at the work that's beginning in New Hampshire through the Go North and the Foundation for Healthy Community Hub. And then we'll bring everyone together for a panel discussion on the stages that providers will be moving through as they turn this rural health opportunity into improvement. Talk about planning, implementation, measurement, improvement, and ultimately sustainability. We'll also explore how CMS's quality improvement program and our teams can help with that. Next slide, please, Sarah. As we get started, we would love to hear from you. And so I invite you to introduce yourself in chat with your name, your organization, and role. And if you can, please share one either rural health transformation or quality priority that your organization is currently thinking about. That'll help us keep today's discussion grounded on issues that are most relevant to you. Next slide, please, Sarah. Briefly, for those who may not be familiar with us, CMS's Quality Innovation Network Quality Improvement Organization is a national CMS-funded program. IPRO leads the Northeast and Mid-Atlantic regions, covering about 24% of the Medicare beneficiaries in the country, in collaboration with my organization, Health Centric Advisors, and our partners at Clarent. Our role as a QIO is to work directly with healthcare providers, hospitals, nursing homes, and outpatient clinical practices to support improvement and align with partners, including the Rural Health Transformation Program, to make that both maximize improvement, but also sustainable. Next slide, please, Sarah. We use practical technical assistance, data, tools, coaching, and peer learning to support providers. We support providers around quality and patient safety, care coordination, behavioral health, workforce, emergency preparedness, and healthcare technology. Whatever a particular provider wants to focus on within that domain, we're there to help. And today we're going to explore what that looks like in terms of rural health transformation priorities. We believe that they are really complementary, and that a provider who, for example, is working to improve access to care or strengthen transitions between settings, implementing new technologies such as remote patient monitoring, improved behavioral health integration, that we can help support the funding and the investment from rural health and make it feasible and achievable within each individual setting. And I am going to have you go to the next slide, please, Sarah. So the Northeast and Mid-Atlantic CMS QIN-QIO team brings multiple disciplinary team, which includes physicians, pharmacists, nurses, social workers, data analysts, dietitians, quality improvement professionals, and digital health experts together. That matters because rural health transformation touches many parts of an organization: clinical workflows, staffing, care transitions, data, technology, patient engagement, and community partnerships. Through iPro, Health Centric Advisors, and Clarent, organizations can access a deep bench of support that's tailored to that organization's priorities. And today, partnership is an important theme. There really should be no wrong door for providers, and our organizations, and we'll demonstrate that today, are working together to ensure that the providers who need support know about these opportunities, are able to access these opportunities, and make them work within their care settings. And with that, I'm going to turn it over to my colleague, Anne-Marie, to give us a broader perspective of the Rural Health Program. Anne-Marie?
Thank you, Lynn. So just briefly, I know Lynn already introduced me, so I won't spend much time there, but wanted to share a little bit about our organization. So I am Anne-Marie Day, our Chief Operating Officer. I'm coming to you from Maine, but we do serve all 6 of the New England states. So we are actually the only regional rural health association. Prior to my life here with the New England Rural Health Association, I did spend some time at the QIN-QIO, so just has been a long-standing and wonderful partnership. So we're glad we could bring this perspective here to you today. Our organization has been around for over 30 years, but we're officially celebrating our 30th year of service this year in 2027. We've really served as the voice of rural in New England. We do a lot of advocacy work on rural issues. But we also do a lot of programming and provide education, technical assistance, training, and resources. We have over 6,500 voting and associate members, and that's really across the board. Anyone rural, whether it's a community-based organization or rural facilities or academic partners, really our mission is to improve the health and well-being of the New England rural communities, and how we do that is through our partnerships and strong connections. So I just want to put a quick plug in for our rural annual conference. This year it's in Concord, New Hampshire, and it's November 17th and 18th. We will be bringing you a panel of our New England RHTP directors. So a great opportunity to just continue this conversation and learn more about year one sort of successes and what's coming ahead for the program. Next slide. So I'm sure you've all heard all about RHTP and have some background, so I won't spend too much time, but wanted to just give the big picture and sort of the high level overview about the program. There is $50 billion awarded over 5 years. These come through CMS and are cooperative agreements with the states. So again, each state is really doing things different. They all submitted their own plans and budgets and their priorities based on what was needed within their states. So we'll talk a little bit more about one state's perspective, but I'll share some resources depending where you are, because I know we have the whole Northeast and Mid-Atlantic focus here today. And so where are we in this process? Year one already, wow, it's been a wild ride. We're almost through the first year. So states have already had their budgets approved. They're establishing, their transformation teams and offices. They're selecting subrecipients and contractors and really beginning to implement initiatives. States must obligate their funds for this first year by October 30th, and then budget period year two starts October 31st. So, the summer has already flown by, but we're getting there through year one. And just some of the priorities, I think, Lynn, your slide really hit home that there is overlap, and that's why it's so important we, consider our partnerships and align and not duplicate efforts, but really uplift and support. So, there'll be a lot of initiatives and activities around population health, workforce, technology and innovation, disease prevention and care, and health promotion. So there is so much great work happening, and then also great supports and resources through our organization, the QIN-QIO, and your state-based organizations as well. Next slide. So just wanted to touch base on a few resources that are available to you. We have been working closely with the National Rural Health Association just to monitor all of this. Being the only regional rural health association, we've got all 6 states to worry about and focus on. So they've done a nice job creating a tracker for RFPs and where states are at. So it really is that state specific. We highly encourage you to check that out or to visit your state's RHTP page, since that'll give you the most up-to-date and state specific information. The CMS Office of Rural Health Transformation also has a page, so if you want more broad information about the program, they are also doing state program highlights, and there's more like FAQs and fact sheets and sort of program timelines throughout that. You can also email them, and I know Kate Sapper, the CMS Office of Rural Health Transformation Director, they're busy doing state visits at this time and really wanting to get out to our rural communities and visit with our partnerships and programs across the state. So one more resource I just want to touch on, us at NERA will be coordinating a New England Rural Health Transformation Center. We'll be helping to support all of our offices through New England, and just one of our main roles has been convening and collaborating and really working through challenges and sharing best practices across the region. So we will be working through that as that gets contracted and going, and so we'll share more as it evolves and really comes to fruition. But if you have questions, feel free, you can always reach out either to our admin email listed there or to myself, and we'll share that contact. So that's a little broad brush about the program. We're fortunate to have a state-based program and initiative here from our partners in New Hampshire. And so I think with that, we can turn it over to the Foundation for Healthy Communities.
Great, thank you so much. And it's nice to be here with all of you this morning. And you're going to keep hearing the same themes, I think, for me, that we've been talking about. And that really is a partnership and collaboration. So like Lynn had said, I'm Chris Herring, Vice President for Quality Improvement at the Foundation for Healthy Communities. Excited to be able to share a state example with you this morning. We are the affiliated organization of the New Hampshire Hospital Association, and I like to fondly refer to us as the quality and program arm, if you will, of the association. So we work with hospitals and a broad host of other stakeholders who are interested in improving healthcare for all in New Hampshire. So our mission is really to build healthy communities for all by leading partnerships and fostering collaborations, creating innovation and solutions to advance health and healthcare. Sounds very much like the initiatives or the priorities for the RHTP. Next slide, please. So this is just a listing of some of the areas that we focus on and the programs that we facilitate here at the foundation. And like NARA, we do technical assistance and provide education and support for partners in all of these areas. Quality and patient safety really is the underpinning for the work that we do at the foundation. Where we've collaborated specifically with health-centric advisors started under the 12th scope of work. And we were part of a hospital contract at that time through eQuick. And health-centric advisors was on the long-term care contract working in New Hampshire. And obviously there are great synergies between acute and long-term care. And we came together on multiple occasions, but most specifically, we have held a series of collaboration events for the various levels of care to talk about different areas to improve transitions. So it's been a wonderful partnership over the years, and we continue to look forward to working with them in the 13th scope of work. So with that, I'm going to pass the baton to my colleague, Travis Boucher, who is Vice President for Rural Health Transformation here at the Foundation.
Thanks, Chris. And just to recap, Chris was providing a highlight of the foundation, sharing kind of what the foundation's history has been, what the foundation is focused on. But when we think about rural health transformation, really taking the foundation to the next level into supporting rural healthcare. I'm here really at the end of the day as an ambassador of New Hampshire in the program, and I'll explain kind of where the foundation fits in the larger part of New Hampshire's approach. But I want to highlight, Go North is the foundation, and I just sent the link to the Go North site. It was mentioned earlier how different states have different sites, so I want to make sure I share with you all our Go North site with the state of New Hampshire. And so the governor ultimately established Go North, the governor's office of new opportunities in rural transformational health. Kelly Ayotte, and this is what was funded through the health transformation funds with the federal program. And really, this is the program of the administrating body that's driving the 5 strategic initiatives under New Hampshire's program. Next slide. And this is just a one-slide summary of really how this is being approached in New Hampshire. So you can see the Foundation for Healthy Communities at the bottom there. And you can also note that we're just a piece of a much broader puzzle in terms of how all of this is coming together in New Hampshire. And ultimately, there's 5 initiatives that's being focused on: population health, access, workforce, innovative technology, and financial sustainability. And with those 5 initiatives for change, we're measuring the success and how we're looking at each initiative that we do and making sure that we're measuring the transformational impact, making sure the project plans are strong, the outcomes, what are we measuring? Where are we going? Where are we today with those outcomes? The long-term impact and sustainability. So as New Hampshire and as we as a hub, for example, is rolling out our programs, those are really the framework in which we're doing that in. And as we look at the different hubs, and I actually see as some of our participants, some of the hubs are actually in a participant list, which is wonderful. You have the University of New Hampshire, the CDFA, the New Hampshire Community Behavioral Health Association, and then the Community College System of New Hampshire. And each one of the hubs have very focused tactical, strategic areas that they're focusing on. For example, the CDFA in New Hampshire is primarily looking at, the infrastructure, brick and mortar type support for rural healthcare organizations. And they have come up with a plan. And if you go to the Go North website, you can see what their strategy and plan is. The New Hampshire Community Behavioral Health Association, primarily focusing on mental health, looking at our community mental health centers and really looking at all of the 5 initiatives for change, focusing on our mental health centers. The Community College System of New Hampshire, you noted in the chat here, really looking at that CTE programs for the state. And then University of New Hampshire, the workforce, looking at workforce in New Hampshire. And then the Foundation for Healthy Communities, really pulling it all together in terms of clinical programmatic initiatives, looking at technology development, looking at workforce as well. We've rolled out in terms of proposals already. We have our dental school-based care programs looking to promote rural school-based care dental programs. Our EMS and mobile integrated health RFA we've rolled out and actually closed and reviewing applications right now. Primary care just went on our website in terms of supporting rural primary care access. That we have a hospital coming up and a technology this year. So really working to roll out some core focus areas in supporting the programmatic and technology infrastructure. So again, just to recap, we at the end of the day as the foundation, we are part of a much larger system, but all of us are working together. And as you all know, this is rolling out really quickly. And so we have, I believe, New Hampshire has the ship built, and we're just finishing building it and moving it forward. So,
Thanks, Travis. Can I have you go to the next slide, Sarah? And before we jump into the panel, we do have some items in chat, and I just Travis, I was so excited that you mentioned dental because there's an example of and I love it, the idea of these free dental clinics and training workforce, training RNs to do these checks. So fantastic. And it sounds like there may be an opportunity for some alignment, at least in the New Hampshire, the work. And I just want to acknowledge each state will look very, very different. We're going to talk specifically about New Hampshire, but we hope we also give you a sense of what this will look like and who the key partners are and how we can collaborate to help you. I also saw some feedback around measures and being able to monitor that. And I would say that everybody on this call can certainly support that. I would say that we are measure geeks. We want to make sure that if you're implementing something, there is a plan in place to make sure that your investment of time and resources is making a difference and making the difference that you're intending. So our teams are experts on helping to map out a meaningful but feasible measurement strategy with process and proximal outcomes and distal outcomes. So that's definitely something that we're interested in. And Kristen, I see you're looking at from UNH, you're looking at healthcare workforce and retention. That is most definitely aligned with both of these programs. So the QIO program is supporting workforce, specifically in nursing homes, where turnover tends to be pretty significant and a post-pandemic real opportunity. So helping nursing homes look at both recruitment, but retention strategies and staff stability, which is essential for patient and resident care. As I'm going through, I know I'm not going to get to all of them, but we will try to incorporate some feedback as we're talking with folks. If I miss something, please let me know, jump into chat. And if you want to hear more about the other work, then just jump in and put it in chat and we'll follow that. So with Without further ado, I am going to just briefly introduce our panelists again. So Anne Marie Day, who you've heard from, the Chief Operating Officer at New England Rural Health Association, Travis Boucher, the Vice President of Rural Health Transformation at the Foundation for Health of Communities, and is leading the Foundation's Rural Health Transformation hub in New Hampshire. And Chris Herring, VP of Quality Improvement at Foundations for Healthy Communities. And all three groups are really great partners and collaborators with the QIO, so I'm grateful they're here today. And we're also joined by Karen D'Antonio, who is my colleague, and she is the lead for the work in the QIO work in Connecticut, Massachusetts, and Rhode Island. I'm going to do a quick plug. The QIO program is funded by CMS. There is a brief enrollment period, and then we move into improvement. I mention that because the enrollment window is closing. Hospitals, nursing homes, and outpatient practices have an opportunity to join the QIO program and get free, no cost support until the end of the month. And after that, we are shifting over to improvement and really aligning our support with programs like this and others. So I'm going to have Sarah go to the next slide, and I'm going to invite my panelists to jump off mute and explore the program. So again, we've sort of talked about the areas that the Rural Health Program funds. And I think one of the areas is just from a provider who might be applying for funding under this. You know, I would love to hear from our panelists what how providers should start to identify priorities. I'm going to use an example because I think that's always helpful. In Rhode Island, for example, providers will have an opportunity to apply for funding that supports an enhancement of an existing EHR, that it supports enhanced access to care, something like remote patient monitoring or telehealth implementation, or something that the third area is something that's innovative. And that potentially could be something like an AI scribe for physician offices. I'd love to hear each of the panelists' thoughts on where do you begin in identifying the what? And importantly, how do you think the QIOs can help? I'm wondering, Anne Marie, do you mind if we start with you?
Yeah, sure. Identifying the what. So, I think we all know within our local levels and communities what the needs are. So really, I think reviewing your state's opportunities and priorities and how that fits into those, and that it could be flexible under different buckets. So we've talked a lot with our community partners that, maybe it is a technology-based initiative that you apply for and go after, or maybe it's under more of the chronic disease. But there's different ways to go about that and get that funding. So really, I think just the planning and having those partnerships established, starting the conversations, getting as much together as you can, and how you want to shape your both your application and your programming, so that you're ready to go and respond to some of these open RFPs.
Okay. It looked, Travis, like you were ready to jump in. Please do.
Yeah, I just wanted to note for New Hampshire, we're really developing a lot of opportunities for planning. And so, for example, Go North published a proposal, again, if you guys go to the website, called a planning grant. And so for those organizations that really have no idea, what's available, what they could be doing, what to dig into, they're making planning grants available to help those organizations. That's one example. I think the reason why we're all here is because I think the QIO and their work with CMS and leveraging them as a partner and looking at different ways to move the organization forward as we think about rural health transformation. Also, as the states, especially New Hampshire, as we're pushing out materials, there's program guides. So if you happen to see the Foundation's program guide, I encourage you to look at that. It starts to highlight what our plan is over the next couple of years. I mean, obviously year 2 is not as detailed as year 1, but begins to highlight the priorities and working with our Go North partner and collaborating on the priorities that the state has committed to CMS for New Hampshire. And lastly, within our applications, we are framing it as a way for program project development. And so we recognize that not all organizations are at the same stage of readiness. Some organizations are in project development, some really need foundational investment, and others are program ready. And so how to roll out a program that's taking into account those different layers of readiness to support those organizations.
Fantastic. And Chris, it looked like you are also ready to jump in. Please do.
I know we always have so much to say.
Yeah,
I was just going to add to that. And part of the work that we're going to be doing is at the foundation, as people are planning, is providing some technical assistance for people, right? Not everybody knows exactly, like you said, where to start. And I know, Lynn, one of the things we had talked about, sometimes identifying, data, right? And looking at, okay, as we think about these patient populations, or this area that we think we need to improve, what data do we have behind some of that, which is so important when you think about the downstream measurement and improvement, right? And that's going to be a big part of applications, and that's part of what CMS and Go North and are going to be looking for is, to see what is going to be, what's baseline and what's going to be measured and improved.
Yeah, no, and I think that lends itself nicely to my colleague Karen, who I invite to jump in with. So, got data. What can the QIO do, Karen, around that?
No, thank you, Lynn, and thank you, Chris, for mentioning the data. The QIN-QIO, can serve as a partner in this process, in the planning process, and we can help providers interpret that data, identify those gaps and disparities, prioritize opportunities, and connect them with evidence-based interventions and best practices, and really connect with other rural communities. As Anne Marie and Travis and Chris also mentioned, each state is unique. So looking at kind of what the plan is, but we can help providers develop and measure measurable aims, establish those metrics, engage patients and the community partners, and just think through how the improvements can be sustained beyond the initial funding and moving forward. So the QIN-QIO really helps providers move from identifying that need and developing a practical improvement strategy and measuring whether it's actually making a difference for the people they serve and tweaking as they go along.
Yeah,
using the data to back that up.
And I just to be really concrete, the QIO has data reports that we run for every single hospital and every single nursing home. So they're already existing. Starting with public reported data, which everyone has access to, but most folks don't even know it exists. And so we're able to pull it down and provide that to providers. So we call it a standard analytic report. And we literally just did that, updated the data, everything except for the new hybrid readmission, hospital-wide readmission measure, which hasn't been published. So, but that's a really good place to start, is looking at the publicly available data. And then the other data that we have is claims-based. I will acknowledge that QIOs are funded by CMS, and so it's really focused on the Medicare population, but it's a great start. And to Karen's point, helping providers understand that data is something that that's one of our core competencies and focus areas.
And Len, just while we're still talking about planning, I think there's so much great work happening already. And so if you have an idea, I'm just going to make something up. Say you want to look at mobile integrated health, and there's already folks that have started, as Travis mentioned. People are really in different places. So reach out if you have an idea and you want to connect with folks, whether it's across state lines or across the region. We're always happy to share and connect. And I think that's such a strong benefit of this region and these partnerships, is people are very open to that collaboration and, getting a head start with what's already been done and sharing best practice so far.
Anne Marie, that is an excellent point because so from the QIO perspective, it's 16 states and territories worth of peers who are probably struggling with similar issues. And to your point, some may be just a little bit further ahead. So collectively, I think this group can help make those connections. And going to be honest with you, connections are the most valuable part for me in this work. Money is great, but if you don't understand how to use it, don't know what's available, it's you might miss out. I am going to invite my panelists, if you wouldn't mind, while we're going through, to share, and I will, these slides will share following the session, that's along with the recording, but if you wouldn't mind sharing your contact information so that if somebody on the call hears something and we didn't dive deep enough, that they can reach out, that would be fantastic. And we'll include it as well in the notes. So with that same sort of approach in mind, once a provider identified that particular challenge that they want to work on. So whether that's through a planning grant, Travis, to your point that, you know, some folks have, or working with the QIO or other partner in identifying what are the biggest gaps and areas of opportunity, what's successful implementation look like? From your perspective, and again, I'd say how can the QIO, but also how can you help? Anne Marie, we started with you last time. Do you mind if we do that again?
Oh, okay. I thought you were maybe going to give it to
No, I was going to give you.
someone.
I was going to give you a leeway, and then I was like, no, she can take that.
Yeah, I mean, successful implementation, I think will look again a little different for everybody. It's that capacity building, I think, for our rural organizations, some being smaller, some being larger and having more resources. So and I think it does tie back to that measurement and monitoring, and really, I think, doing some PDSAs and some rapid evaluation of, like, is this working? How can we adjust? What is working so far? What do we need to change? And so just utilizing that initial investment in year one and implementation to get things started, but also really start right away with looking at, is it working and how can we tweak and adjust to get through this year one period.
The PDSA cycle, I love it. Yes, that's most definitely an area that I think all of us on the call can certainly help with. Travis, what about you? What does successful implementation look like?
You know, I'll note, you know, I'll take that question, just put a little different flair to it. You know, as we are looking at the applications coming through, having a really strong project plan that's outlined and really detailed, that shows us kind of what your implementation plan is going to be critical in terms of scoring higher. And you know, success and sustainability are really important in terms of how we're evaluating these programs. And I also noted we are looking at this in different stages, right? So an organization that's in project development will be looked in terms of their project plan slightly different than an organization that's applying as a ready program. But just having a really solid plan around implementation is going to be critical, which for the different activities we're supporting, they're going to vary in terms of developing or expanding your mobile integrated health project, or you know, implementing a new population health module on your EMR to better track data and analyze it for your organization, all the way to, you know, helping implement electronic dental record in schools, which is part of one of the RFAs that we've already rolled out. So.
No, that's fantastic. And couldn't agree more. I just want to acknowledge Melissa's comment about challenge with data especially with critical access hospitals. The numbers are so small, and sometimes because they're small, they're not as meaningful. And so trying to have that peer group for benchmarking is extremely helpful. And Melissa, with the QIO work, not as much with the public available, those standard analytic reports. We don't do benchmarking because with that particular report, the data is already risk adjusted, so benchmarking doesn't make sense. But with our fee-for-service data, we do. We do comparisons with both state groups of critical access hospitals, but then across the larger network for the exact same reason. So it's the data, you can see where you compare against others, and I think, again, my leaning is we can also connect you with others to see what they're doing that makes their data look a little bit better, perhaps, than yours in certain areas.
Just want to
Jump
plug
in.
to connecting with your State Office of Rural Health and their Flex program. We often work with those folks to share both at the state comparison level, but nationally as well. Their MBQIP and CAPS and all of those measures too. So there is some more local based things for you.
Yeah, no, I absolutely agree. And if somebody doesn't know where to go, it can be a little overwhelming. And I guess the one thing we talked earlier was that it really should be no wrong door, whether you're reaching out to Anne Marie or Travis or Karen. We should be able to support you, and that's our intent in all states. I know, Anne Marie, that's yours with the New England folks, is to make sure whoever you go to, we're going to be able to guide you towards funding and the right level of support. And support will look, Travis, you've said it a couple times, but I really want to underscore it. Each state has their own plan and their own implementation. So Vermont, they're doing some learning collaboratives around chronic disease prevention. Fantastic opportunity, and aligns nicely with the work that QIO is doing. So we're definitely not duplicating efforts. We would support that work in partnership with those folks. And again, looks a little bit different. I want to be respectful of time, but I'm wondering, Karen, we talked sort of at a high level, but let's be real specific, because there's a lot of money going into technology. And so if we were to say a provider applied for and received funding for remote patient monitoring, for example, what could the QIO do that would be supportive of that? What does that look like from start to finish?
Yeah, at a high level, just for a couple of minutes, that's a great opportunity, remote patient monitoring. And we have helped many providers with remote patient monitoring. And it really, starts with looking at what are you as a practice providers trying to accomplish. The technology piece is one side, but it's only part of the solution. The success depends on how the remote patient monitoring is integrated into the care delivery, supported by workflows, engaging staff and patients in strong community partnerships for referrals, meaningful measurements, and ongoing quality improvement. So we really can help the providers, align the initiatives, assess for the readiness from the staff and from the technology that you have, develop recommendations of workflows, design that care coordination, define those roles and responsibilities for the care team, engaging the staff, share evidence-based practices. You mentioned that we have a network of, the Mid-Atlantic and New England states that many have provided remote patient monitoring, so we can learn from one another and we can connect people with like providers for that purposes. We can help, really the project plan development, as you said, Travis, what does it look like? And we can really support that development, including those PDSAs. So I really think there's a great opportunity for us to kind of start from the beginning and help you all the way through your journey.
No, that's great. And I know there are other questions that are in chat that we may not get to. I just want to acknowledge that and indicate that we will, when we send out the slides, we'll also respond to those questions as well as follow up individually with anybody who asked a question. So I don't want you to think we're going to leave you hanging there. We most definitely will not. And I think the goal of today really is to make sure that providers like yourselves and others are aware of the support that is available, that is no cost. And this funding, I mean, Anne Marie, $50 billion, it can't, that's a lot of money. But if you don't know where to begin and you're sort of navigating it alone, it can be overwhelming and you might not take advantage of it or know the best way. And I think that's something that collectively we can help with. I want to just go to the next slide. Thank you, Sarah. So recognizing the time, 45 minutes, especially with this group, because we work together quite a bit and we all have some really great thoughts about support, goes quickly. I would say this, as providers are beginning to think about rural health transformation opportunities, we want you to know it's not just about the funding. It's about thinking about how you take that investment and make it work within your own environment, improving access, strengthening care coordination. I saw a note, question about how the non-clinical providers, we work with community-based organizations quite a bit to help with the clinical community connection and mapping out referrals and feedback loops. So there's most definitely a place for that in with programs. How you can take and improve quality and safety and sustainable change with both funding, but also support. And so the key message here is, as providers, you don't have to do that alone. On this call, you have a great example, the New England Rural Health Association. And as Anne Marie said, every single state has one. We just, in New England, happen to be lucky because we have one that covers all 6 New England states. We heard from the Foundation of Healthy Communities, and the hub that they're running in terms of the Go North, which is the New Hampshire rather plan. State partners, and we saw a few of you on the call, as well as the QIO, can work together to help you plan, implement role-based workflows using the right people to do the right job at the right time, measure, looking at the data and then monitoring it, and then sustain. And I would also just acknowledge one of the QIO's goals is to highlight success stories with CMS and help spread. So we do that through peer learning. We also do that through success, and we do that through quality awards. It's a great opportunity to get your work highlighted with CMS and also help others along the way. As I said earlier, the QIO program is CMS sponsored, funded. There is no cost for providers, but enrollment is limited. You can enroll you can enroll now, but if you find it's not working for you, you don't want to be involved, you can unenroll at any time, but you can only enroll until the end of the month. So if that's of interest to you and you want to start with the QIO, we're going to make it super simple. You can complete the agreement, which is you can scan a QR code that's on this slide, go to the link. As a provider, you determine how much you want to engage and the topics. You don't have to do everything. And in fact, we work with you to understand what is the biggest priorities, whether that's rural health transformation work or whether that's something else. How often and frequent, who you want to work with in terms of, a lot of hospitals will have their entire team and others only have maybe a pharmacist or their quality folks, totally up to them. We help you with an assessment for quality improvement in technology, also great for planning purposes. And then we work on a plan for the first year and we modify it as we go. I apologize because we went over. I thank you for your time and your attention. I want to thank our panelists today, Anne Marie, Travis, Chris, and Karen. I hope this discussion is always helpful for me, and I appreciate the opportunity to explore it with others. if you have questions, please note, we will be sending out the slides. They will go out with the panelist information, but they're also right in chat. So feel free to grab an email and reach out. Thanks, everybody, so much. I hope you have a wonderful rest of the day.
Thank you.
Thank you so much.
Thank you.